I'm Dave Rowe. I'm Senior Research Fellow in Silicon Photonics, and I do healthcare research, so trying to do something useful with all of the wonderful technology we make here.
My name is Colin Soames. I am a Principal Research Fellow at the ORC, the Optoelectronics Research Center. What we have been doing over the last 8 years, I'm sure all of you now know of a lateral flow test. What we have been doing over the last 8 years is trying to make those lateral flow tests smarter so that they can measure several things. They can measure those things accurately, and they can quantify the levels of what they measure.
I'm surrounded by doctors and nurses and biomedical scientists, interacting with them, seeing what their issues are. And then we've had patient-public involvement as well, so learning from patients and their families and support structures what the shortcomings are of, for me in particular, the role of technology in managing their condition and how that could be improved. So I see photonics in healthcare evolving in the next 5-10 years to include lots more regulated devices. So the two use cases that we're focusing on are cancer detection and drug monitoring, but there's a massive variety of different applications that we'll see coming through that are already in the pipeline.
The benefits are obvious. For the patients, it's quality of life, because early diagnosis kind of relates to a more directed treatment and hence a better quality of life. But then it also reduces the burden on the NHS in terms of the costs that are incurred for the future treatment, right? Because if you can pick something up earlier on, then you reduce the burden on the NHS in terms of the use of the resources, both people and the systems.
I love what I do in photonics because I like the prospect of it doing something useful, and that's really what I've gotten from working in the hospital, is seeing these cases where technology can really help.